I have the pleasure of introducing our next two group speakers, which are division directors, Dr. Aurrecoechea and Dr. Bloem. Dr. Aurrecoechea is our Director of Social Emergency Medicine, as he's introduced himself before, and Dr. Bloem is our Director of International Emergency Medicine, as well as the Fellowship Director.
So good morning, everyone. So excited to see so many people here for this excellent symposium today. I think the previous talks by Arthur Ashe and the Downstate Asylum Clinic are great segues into our presentation here, as we'll be alluding to a lot of the work that they do and how we integrate with the services that they make available. So as Dr. Smith said, I'm Dr. Christina Bloem. I'm a professor of clinical emergency medicine and the director of the International Emergency Medicine Division, sometimes known as the Global Emergency Medicine Division. We have a fellowship program, and Dr. Aurrecoechea and I work quite closely together. He is also a global emergency physician in addition to being the social EM division director. Our divisions have a lot in common, and we're going to talk today about how our divisions integrate with our care for our immigrant patients in the ED. So as was previously mentioned, caring for global domestic patients really means integrating social determinants of health into our care for our patients in the emergency department. As we are intimately aware, when we see our emergency care patients, it's not really only physical needs and physical health problems that they present with, but their social determinants of health, their social factors such as housing instability, legal status, access to employment. All of these things impact their health and sometimes are causative factors for the health problems that they present with in the emergency department. We see this firsthand every day in the ED, and we look to keep those things at the forefront of our mind and be able to connect patients to resources so that we can address them in a holistic manner. And as we know, as New York City continues to welcome tens of thousands of new immigrants and asylum seekers, most recently populations fleeing humanitarian crises, we have to remain agile in adapting to these needs. So we're hoping to exchange some best practices and how we integrate these approaches in the emergency department with our patients. You can, next slide.
So I'd like to talk a bit about our social emergency medicine interventions that are broadly applicable in multiple specialty settings. I will speak to what these interventions look like in the emergency department at Downstate and Kings County, where we address the social needs of our global domestic patients. So for one, we had food insecurity screening. So to address social determinants of health, we screen for food insecurity and other social determinants of health at triage in the emergency department at University Hospital at Downstate. And a positive screen automatically connects patients to local community-based organizations within our area, particularly to one of the organizations, Community Care of Brooklyn. And then at Kings County Hospital, we are rolling out an initiative where providers can refer patients to community-based organizations that we partner with, such as CAMBA, when our providers identify food insecurity, among other social needs. In terms of housing assistance, our social work departments have systems in place to link patients that we identify, link them with community-based organizations that provide housing support. And it's important for hospitals to build relationships with shelters or housing advocacy groups in the community to facilitate this. In terms of legal aid referrals, another outstanding need. Our social workers are also able to connect patients with organizations offering legal aid for immigrants, focusing on issues like asylum, deportation defense, and immigration paperwork. CAMBA is another local organization that offers this in addition to the Downstate Asylum Clinic. And then finally, in terms of trauma-informed care for our immigrant and global domestic patients, many immigrant patients have experienced trauma, which we heard in previous lectures, whether from pre-immigration events such as war or persecution, or post-migration issues, detention, family separation, etc. So part of addressing this is training our residents, our faculty, our staff on trauma-informed care to better respond to immigrant patients' psychological and emotional needs. Next slide, please.
So from the global emergency medicine perspective, how do we apply a global health framework in the ED? So we look at immigrant care from a global lens. Immigrants bring both their global experience and now their migrant pathway experience and their local experience. So it's a combination of factors. As far as some of the interventions, one of the important ones, which was spoken about in one of the previous talks, is infectious disease screening. In the Global Emergency Medicine Division, we do have experience in training in infectious and tropical diseases just by the nature of our work. And we also work closely with our disaster preparedness division to be in tune with recent outbreaks of infectious diseases, protocols for screening, contact tracing, and connecting patients with public health authorities as is appropriate. It's the previous slide, Dr. Smith. Thank you. We also emphasize cultural competency training. That's something that's done very integrally in our residency program by the nature of the patients that we serve. And I think the world that we live in, it should be something that's pretty standard at this point. But we bring an understanding of these cultural differences to the table from our experience in global emergency medicine, and emphasizing the importance of cultural competency, both in our work abroad and in our home ED. This is one of the papers that one of our faculty, Dr. Muchatuta, published, which emphasizes the importance of cultural competency training and addressing the needs of our patients. As we know, cultural factors such as health beliefs, treatment preferences, and communication styles, as well as the minimum of language, impact our ability to care well for our patients, as Umberto actually mentioned quite extensively in the prior presentation. And in addition to that, partnerships with asylum clinics and survivor care clinics are key. We, as global emergency physicians, are aware of some of the pathways and locations that are at higher risk for trauma and survivors of torture. And we bring this knowledge to our ED here as well. It's really important to be able to have training in the skills of specific careful history taking and interview techniques to be able to identify these patients. And without implementing those things, the opportunity for intervention is lost. As we know in the emergency department, this is often the first and sometimes only point of contact of immigrant patients, patients at risk with the healthcare system. So we have a really unique opportunity to identify these patients and be able to connect them with resources. So screening is really important. These patients can have physical injuries as well as mental health problems such as anxiety, depression, PTSD, and are even at risk for suicide. And once we identify these patients, of course, it's important that we not only identify them, but connect them with resources. Unfortunately, as Sabrina did the beautiful presentation, we have our own downstate asylum clinic. There are other clinics in the city, but we have our own home clinics, which is wonderful. Although I know the demand is high, we have something local that we can connect patients with for both clinical services as well as legal resources. Next slide. So how do we, in the social emergency medicine and global emergency medicine divisions, combine our approaches for a comprehensive care model? Again, our social emergency medicine faculty and residents who are now trained by these faculty are able to adequately identify social risk factors such as lack of housing, legal support, and other vulnerabilities that can indicate the potential for situations of human trafficking. And as global emergency physicians, we apply our global lens to understand trafficking networks and exploitation patterns from certain home countries. And combining these tools allows us to screen for trafficking victims and referring them to appropriate specialized services. As far as survivors of torture, again, we try to identify these patients and connect them to the necessary mental health services, recognizing the global context of where patients, certain countries that have coming from conflict areas and humanitarian crises areas, the patients that may be at risk and who we might want to keep a special eye out for. And there are specialized clinics such as the Bellevue Survivors of Torture Clinic that provide care for these patients for their full spectrum of needs, both physical, mental, and legal. And then finally, as far as addressing infectious diseases in immigrant populations, again, both of our divisions' perspectives complement each other. So social emergency medicine identifies patients at risk due to complicated social situations, difficult access to care, insecure housing, poverty, and so forth. And the global health context, of course, ensures that we're aware of diseases that are uncommon in the US, but are prevalent in the countries of origin, as well as being in tune with global outbreaks as they come up. So continuity of care is really crucial for these patients. You know, it may be, again, their first point of contact with the healthcare system, and ensuring connections with ongoing healthcare after the emergency department. We have really brief interactions with our patient. It's a unique opportunity, but a stressed and difficult environment to actually provide all of the resources that they need. So connecting with community resources and other departments, other services, social work, and so forth is really critical in being able to ensure continuity of care for these patients.
Fantastic. So I want us to understand a bit more about our unique context in New York City when it comes to both recent and long-term immigration to our city. So I'll share some key statistics with you. So first, let's look at the scale of the immigrant population in New York City. So immigrants make up 36 to 38% of the city's population and 43% of its workforce, which means that nearly half of the workforce driving essential industries in the city are immigrants. Since the spring of 2022, we've now seen over 210,000 migrants pass through the city. The number on the slide has since been updated, but with over 66,000 still under the city's care. Many of these individuals are employed in critical roles. 70% of undocumented workers are part of essential industries such as food, service, healthcare, and construction. And these numbers highlight not only the importance of immigrant populations to our city's economy, but also the immense pressure that this places on social and healthcare services, especially as we manage such a large influx of recent migrants. Next slide, please. So for health and social services for immigrants, the New York City Mayor's Office of Immigrant Affairs has been really instrumental in supporting these communities. So in 2023, that office provided 11,467 comprehensive legal screenings and translated over 1,500 documents into 49 languages. And these services are vital for immigrants to access healthcare, legal support, and social services. So in response to severe humanitarian crises and the influx of asylum seekers, the city launched initiatives like the Ukrainian Response Initiative and Services for Haitian New Yorkers, which demonstrates a commitment to quickly mobilize resources to meet the needs of immigrant communities during times of crisis. Next slide, please. So for healthcare access, New York City offers many low-cost health services to immigrants, regardless of immigration status, through New York City Health and Hospitals. These services include general health care, mental health support, and trauma care, which are particularly crucial for asylum seekers and survivors of torture. However, the city is also facing a labor shortage in the healthcare sector, with 39,000 job openings identified for migrants and asylum seekers. This underscores how essential immigrants are to maintaining our healthcare system, as they not only require services, but are also a significant part of the workforce, keeping these services operational. So to conclude, these statistics emphasize the critical role that immigrants play in New York City's workforce and highlight the ongoing efforts to provide comprehensive care. From legal to social services to healthcare, the city's taking steps to improve outcomes for immigrant populations. It's clear that our emergency departments as well also play a crucial role in connecting these individuals with the services that they need and ensure that they don't fall through the cracks. Next slide.
Great. So just to wrap up, I wanted to bring out a call to action. In our social emergency and global emergency divisions approaches, we've combined our efforts to try to help provide comprehensive, holistic view of the immigrant patient and their needs. And we, again, have a really unique position in the emergency department as the first and sometimes only point of contact with the healthcare system for many patients, particularly immigrant patients. And we're fortunate that our residents and our faculty in our residency program are people who kind of come with this nature to be advocates for social change, to be in tune with social determinants of health, but it's definitely something that needs to be integrated as a part of what we do as part of our care, not just our medical care. So as a call to action would be to advocate for continued structural changes to support our immigrant patients. Again, interdepartmental collaboration is essential. We are all pressed for time, and we really require this to be a combined joint team effort in being able to address all of our patients' needs. Again, community partnerships are also key. Patients require ongoing care, continuity of care, and they have a number of needs to be addressed that can't be addressed solely by one individual, one organization. So we depend on our community partnerships and continuing to grow those. And professional development. So we as clinicians need to have the appropriate skills, the appropriate training to be in tune with these needs, to know how to identify these patients appropriately, and understand really how to provide holistic care for them. So we hope that we can continue to build frameworks to integrate the social determinants of health as well as global health perspectives into our everyday practice. And we appreciate your time.
Thank you. Thank you very much. Much appreciated on all the work that you do in our ED.